Hi, my name is Dr. Christopher Webb. I'm a chiropractor located in Washington, Pennsylvania. I'm also a chiropractic orthopedist, and I've been studying Bertolotti syndrome since 2002. Bertolotti syndrome is a lumbosacral transitional vertebra, and a lumbosacral transitional vertebra is not always Bertolotti syndrome. If pain generation is occurring classically, that falls into the Bertolotti syndrome category, which traditionally is characterized by fusion of a transverse process on one side of the L5 lumbar vertebra with the sacrum and the ilium. It will throw off the mechanics of the entire spine, usually characterized by a scoliotic curve, as well as a sharp lumbosacral angle, and sometimes the pseudo or false articulation at L5 on the transverse process with the ilium can generate pain. What's also significant about this is many times when an MRI is performed, it's not captured. It's often missed. The X-ray will be the primary finding or primary diagnostic function to actually see true Bertolotti syndrome. Many surgeons would request a CT scan be performed at 1 millimeter slices to further diagnose and to further characterize the Bertolottis, which is in 4 distinct classifications. Castelvi came up with 4 different classifications for LSTV, or lumbosacral transitional vertebra. Type 1, Type 2, Type 3, Type 4. Type 1 indicates that basically the transverse processes are dysplastic or a little bit larger than what they could or should be, usually at the L5 vertebra. Type 2 is which one transverse process is spatulated or actually articulating with the ilium or the sacrum on one side, and then the transverse process on the opposite side is normal. Type 3 is when both of the transverse processes are articulating with the ilium or the sacrum. Type 4 is which there's a fusion on one side and then a spatulated transverse process on the opposite side, all of which can result in altered mechanics. What is historically noted is Type 2 and Type 4 are usually the biggest pain generators for patients and will cause the most havoc. Ironically, Type 1 and Type 3, the patients have a much lower prevalence of pain. A bit of a history of Bertolotti syndrome is it's actually an old syndrome where it's actually just being recognized at this day and age. It's been around since 1917, which it was published by Mario Bertolotti, an Italian radiologist. Even though Bertolotti syndrome is now recently coming up in publications in the scientific literature, it's been around since 1917 when discovered or published by Mario Bertolotti. The population prevalence of Bertolotti syndrome is noted to be between 5 and 30% of the population. This is dictated by the inclusion characteristics that the study may actually have. If there is low back pain within the diagnostic data, it will actually increase the percentage noted within the study. If there's no low back pain noted, it will actually decrease the percentage within the study as well. On average, you can judge around 18% of the U.S. population has Bertolotti's, or a lumbosacral transitional vertebra. But only a small percentage of patients actually have pain. So there's many hundreds of thousands of people walking around with this congenital anomaly, have no idea it's even present, and are actually walking around pain-free. But there is a percentage of the population that actually has significant pain generation from this congenital anomaly.